Good morning. You're watching Breakfast with Charlie State and Naga Monchetti. Now, MPs have agreed to higher taxes to help fund health and the social care sector.
The Prime Minister said his plan would deal with the catastrophic costs faced by those who need care. Let's speak now to Helen Whately, who's the Social Care Minister, joining us on the programme this morning. Thank you for your time this morning. Do you accept, and it's been alluded to by, amongst others, the IFS and other commentators, it is possible that notwithstanding the agreement that was made last night and the vote that came out and the new plans around tax, it is possible that none of this money will go to social care. Is that a possibility?
No, absolutely not. And let me just take a step back and give some context to the vote last night and our policy on this. So you will know and your viewers will know that for decades, governments have talked about reforming social care. We know that social care has been in crisis. We've seen the hard time that social care has had through the pandemic. Yet for decades, governments have not been able to come forwards with reforms, not been able to get reforms through. We have seized this. We're the government that has taken this big step. We voted through last night a new funding stream for health and social care, this Health and Social Care Levy, which will provide the funding for big social care reforms, which will give people the peace of mind for the long term that they won't incur catastrophic costs of social care.
OK, so let's move forward rather than backwards. So, Helen Whately, when will the first of those tax revenues, the actual money, come into the system?
So we're going to see this start as of the next financial year, so starting in April next year. That's when some of the funding starts going through into the social care system. The cap on the amount that you'll be able to...
Can you give us some numbers? How much? So we're talking about April of 2022, and money will start going to the system from this new tax. So how much?
Yes, so over the 3-year period starting in April 2022, 5.4 billion is going to go into social care. Just under half of that will go to fund the charging reform, so the cap of 86,000, and also our policy to raise the threshold at which you start getting help. So to raise the threshold from around 23,000 to £100,000 worth of assets, that's the point at which you will start to get help with your social care costs under this new policy. And that will actually kick in from October 2023. I know that's a little way off. This is a big, big reform. It simply takes time to implement. So we're getting on with that as quickly as we can.
OK, let's talk a little bit about
starting,
that.
Just hold me out here. Also, just hold me. But starting as of April next year, we'll be putting the funding into other parts of the reform, including starting to provide local authorities with the funding they need in order to pay what we call the fair cost of care. So to make sure that they're fully paying the price of care for people who are state funded. OK,
I think the phrase you used for October 2023 is, it's a little way off. Now, I'm thinking to myself, if I'm someone today, tomorrow, who has social care needs, all of those dates you've given me, April 2022, October 2023, frankly don't mean much, because my needs are now. So if your government is accepting, and I think you are, that the needs are immediate and actually almost at crisis point, why is the money not available now, today? If you accept that more money is needed, do it now, because the need is now.
Well, actually, I mean, we are putting funding in today. And for instance, over the pandemic, an extra £6 billion has gone to local authorities, from which they've been able to use for social care. And we've directed £2 billion specifically into the extra infection control costs for social care during the pandemic. So we are directly, actively supporting social care right now. But what this is about is those big reforms that everyone's been calling about for so long. You can't switch that on overnight. You know, I would love that governments in the past had managed to get this over the line and then the policy would already be in place. But that isn't the case. We're the government that have done this. We're the government that voted this through yesterday. I mean, just to mention, for instance, Labour yesterday voted against these reforms, voted against more money for health and social care.
I think you're slightly missing my point.
And we're getting on with it.
If I may, I think you're slightly missing my point, because if you say the need is now, and you've got to raise the money later on, there's a process attached to that. But there is another option, isn't there, which is you spend the money that you're going to spend in 2023 but do it now. So you borrow the money because the need is now. It is no use to anyone saying there's a lot of policy you have to go through, there are reforms which have been long-standing. They need it now. So why not borrow the money now and do the work now in these crucial sectors, in people's homes, in care homes, when it's most needed?
Well, just, yeah, I mean, you made an important point there about suggesting that we should be borrowing the money. Actually, this is a really significant economic point, is that we're being fiscally responsible. We're not proposing to fund this through more borrowing. We're saying this is going to cost money, and that's why we have put in place a specific tax to pay for this social care reform, as well as tackling the NHS backlog. That is a responsible thing to do, even though it's hard, and I don't like doing it, to say to people, we're going to need to ask for more of your money in taxes.
Well, you're also asking them to wait, aren't you? That's also difficult, isn't it?
Just let me finish. We are putting more money into social care right now, and as I said, as of April 2022, when this comes into place. And more than half of the funding in this package for social care is to go into wider social care reform and to support everybody who receives social care, whether they're paying for it themselves or state funded. It includes a package of over £500 million to support the social care workforce in training and development. And that's a fantastic workforce, but I hear again and again from them, they don't feel valued enough and they want more support in their careers. That's what we're putting in place, which will support that workforce and through that, all the people that they look after. So we are getting on with it. But I will say this big policy to put in place a cap on the amount that you might face as the costs of your care, that does simply take time to implement. We can't turn it on tomorrow. We will turn it on as soon as we can. And that will then give people the peace of mind that they won't face those huge care bills that some face at the moment.
So you're the social care minister. Now, ultimately, your job is about keeping people safe. There is a discussion going on about double vaccinations for NHS staff and for social care staff as well. Is it your opinion that someone working in those sectors should be sacked if they are not prepared to have 2 vaccinations?
So we have a policy that we've already legislated for. That is to require those working in care homes and on the premises to be doubly vaccinated. And that's because we've seen through the pandemic that those in care homes are the most vulnerable to COVID, the most at risk of dying from this disease. And yes, the vast majority of residents in care homes have been doubly vaccinated, but we know that the vaccine is very effective. It's not perfect. There is still a risk of getting COVID, particularly for those most vulnerable residents. And so we're doing the thing, it has to be the right thing, which is to give those residents the maximum protection, and that means staff looking after those vulnerable people should be vaccinated.
Well, can I just pick up? I really want to pick you up on the language around that, because the word you used was should be. So if they refuse, they should be sacked. That seems like is that the logical extension of what you're saying?
Well, we are supporting care homes to work with their staff. So for those who are hesitant and worried about getting vaccinated, to give them the most possible support in order to get vaccinated. Of course, those who have a medical reason not to be vaccinated, have a clinical exemption, will not be expected to do so. That is a relatively small number, we believe. And actually, what I would say to any care worker who hasn't yet been vaccinated is go out and get your vaccination. There's still time between now and September the 16th to have your first jab and then to have then had your second jab by November the 11th.
Helen Whately, what if they don't? What if they don't? It's a simple question.
Yeah, so then the care home will have to work with those staff members to see whether there are any alternative roles that they can do that don't involve being actually deployed working in the care home. But if not, this is really difficult. But I don't know about you, I've certainly spoken to people receiving care in care homes or the families of those in care homes, and they want their family members to be looked after by people who are doubly vaccinated. They want their family members to have the most possible protection against this horrible disease.
No, absolutely understood. Do you know the numbers of how many care home staff or people in the care sector have pulled out of that line of work because of this?
I don't have those figures. As I said a moment ago, so 90% of staff in care homes have already been vaccinated. In many care homes, they've already got 100% of their staff vaccinated. But there are some care homes where staff are more worried, and we're working really closely with those care homes, the NHS as well, to support those staff to get vaccinated.
Helen Whately, thank you very much for your time this morning.
Thank you.
Time now is 18 minutes to 8.